ever wondered if preschool children really understand that physical activity or eating and beverage choices can influence their health? Well, the research suggests that most preschool children have the cognitive ability to understand basic health concepts. Unfortunately, their nutrition knowledge lags behind knowledge in other health topics like safety and hygiene. But the knowledge caboose lagging the most behind in the development of health comprehension is understanding how physical activity benefits health. This is concerning because preferences and patterns of behaviors for nutrition and physical activity established in childhood are often continued into adolescence and adulthood. Well, this is telling us that early childhood is the critical time for adults to influence early and often preferences for healthy foods and beverages and physical activity, and an understanding of how those preferences or choices influence health. A unique study that I often mention in staff development training was conducted by Professor Jane Lanigan at Washington State University, Vancouver. She asked children ages 3 to 5 to identify healthy and unhealthy examples for nutrition and physical activity. But then they had to explain why they answered that way. They were also given the role of being a pretend caregiver for dolls in various nutrition or physical activity situations. And during the role play, the children fed the dolls pretend meals and snacks and beverages, and they suggested play activities for indoors and outdoors, and even responded to not so healthy requests from the dolls, asking for soda at breakfast or watching TV at bedtime. So the bottom line is that the children in this study could identify healthy foods and explain their benefits more often than they could identify physical activities that make bodies healthy. And maybe physical activity is primarily thought of as just fun to most children, and therefore, in their understanding, physical activity relates much more to play, not necessarily to health. And when children were asked to explain how they knew something was healthy, the majority of them didn't know how to respond or said that they learned about it from TV. Neither parents nor teachers were high on the list of knowledge sources. The research to practice application for us is that we need to be the influencers and the role models, and we need to be far more intentional about bridging this understanding gap by creating learning experiences and engaging in conversations with children about how and why physical activity is healthy for their bodies. Lanigan's unique research supports the notion that young children can serve as key informants to guide our practice-based strategies for fostering healthy, active, and informed learners. We just need to ask them.